If the ballot initiative question 2 to establish the expansion passes, it would mark a major win for progressive healthcare activists, the state's hospital industry, and, most of all, the estimated 70,000 Mainers who would gain health coverage as a result. A vote to expand Medicaid, known as Maine Care in the state, also would serve as a rebuke to Governor Paul Lepage, R., who is leading the opposition to the initiative after having vetoed bipartisan Medicaid expansion bills 5 times since 2013. The opportunity for Maine voters to expand health care coverage to so many people, more than the population of the state's largest city, Portland, stands in stark contrast to the national movement to repeal the Affordable Care Act, spearheaded by President Donald Trump and Republican leaders in Congress, that would result in millions losing health benefits. Success in Maine would signal that some voters, at least, want to move in the other direction. Too many people lack access to health care, and this provides a solution. It'll make our healthcare system more fair, so it'll increase access to people who are currently going without the healthcare they need, said Robin Merrill, executive director of Maine Equal Justice Partners, a legal aid organization based in the capital city of Augusta. Merrill also is a spokeswoman representing Mainers for Health Care, a broad coalition of organizations that won a place on the ballot for Medicaid expansion. "We can't afford to wait any longer, and it's already just such a shame that we've lost out on several $1 billion of new federal funds and the opportunity to cover thousands of people," Merrill said. Mainers for Healthcare is joined in support of the Medicaid expansion by dozens of groups, including the Maine Hospital Association, Maine Medical Association, and Maine State Nurses Association, as well as the state chapters of national organizations such as the American College of Physicians and the American Nurses Association. Lepage and several of his closest political allies founded a political action committee called Welfare to Work to fight the Medicaid expansion ballot initiative. The PAC didn't respond to a request for comment sent to the contact form on its website. As written, the Affordable Care Act called for a nationwide expansion of Medicaid eligibility to anyone earning up to 133% of the federal poverty level, which is about $16,000 for a single person and $33,000 for a family of 4. Prior to the 2010 law, poor adults without children living at home or who didn't have a disability mostly were excluded from Medicaid, no matter how little they earned. The federal government pays at least 90% of the costs of expanded Medicaid, compared to a little over half of the program's costs for other categories of enrollees, including pregnant women, children, and people with disabilities. But in 2012, the Supreme Court ruled that states which jointly operate and finance Medicaid with the federal government could opt out of the expansion. 19 states, including Maine, all with Republican governors, GOP majority legislatures, or both, have refused to take up the expansion. As a consequence, there are an estimated 2.5 million people ineligible for help getting health coverage in some cases because they're too poor. Addresses. Because Congress intended the Medicaid expansion to be national, the Affordable Care Act's subsidies for private health insurance are only available to people who earn more than the federal poverty level, which is about $12,000. People in non-expansion states who make more than that can get coverage from the law's health insurance exchanges. But those whose wages are less than poverty get nothing and live in what's called the Medicaid gap or coverage gap. "We work with people and talk with people every day who fall into the coverage gap," Merrill said.